of like help prepping my new patients for appointments here at the Lee Specialty Clinic. And as you know, we have patients with disabilities and needs that it can be kind of scary coming to medical appointments and they don't know what to do.
Sure.
So do you have tips and tricks for me as an intern that I can give my new patients to help ease that?
Right. Well, I have had almost 40 operations in emergency open heart surgery, so this is kind of a perfect fit. One of the things that I like to do is keep a little Ziploc bag in my purse with note cards and a pen. And then I try to go ahead, I have a degree in sociology, so I'm all about research, is if I'm going to a specialist or a doctor that I don't know, then I'll kind of Google them and find out as much as I can about that doctor before I go ahead of time. And just kind of like write down just different things about them.
Sure. That's very helpful.
And then one thing is about rapport building. So that kind of leads back to the research, like, hey, I've heard, you've been in this field for how long, and you've been to this university. Hey, I'm a big UK fan too.
Right.
Or, something along that line. And a lot of times it is intimidating. If you are not a very big talker or you don't know a lot about your medical condition, bring a friend, bring somebody with you to kind of jot down information for you. Or you can just kind of flip your card over and kind of write as you go.
That's very helpful.
If you're going to the doctor just for like a cold or a flu or like an annual checkup, tell the doctor why you're there. Sometimes they don't know. Yeah, you may fill out a questionnaire, but if you have like a complex case like I do, you kind of run out of space. And then, you just quit writing and you're like, I'll explain to the doctor why.
Right.
So that's another good thing. What has caused my illness? A lot of people aren't educated about their conditions, and so they just know they have it, but they don't know how they got it, or if it's something they can pass on to their kids, or if it's something that can be treated. One of my other things is, like if you're sick, do you have to treat it now, or can it wait? I have a torn labrum in my hip, for example. Thought I was going to have a total hip replacement.
Oh, no.
But due to acupuncture and cupping, I am now able to get back in the pool and do therapies and stuff like that.
Oh, that's
so
amazing.
It's kind of one of those things where, hey, this could be really serious, or let's do my MRI, go to a specialist, evaluate it, and then let's just wait it out.
Okay. Very helpful to know.
Treatment options. I am not one on medications. A lot of doctors want to push medications out the yin-yang.
Yeah.
So, is there any natural remedies or is there any herbs or anything like that to kind of help with the process if there's not a medication that I don't want to take?
Okay.
Also, I like to ask the doctors because a lot of them don't know a lot about conditions. If you were in my shoes, what would you do? If you had a loved one with the same conditions that I do, what would you do? Don't tell me, but hey, kind of let's reverse the situation and kind of bring it back to home and see how that would go. Tell me what you would do.
Get a different perspective.
And it really does kind of change. I've asked it several times and they're like, well, I would have recommended this, but now that you kind of threw this at me, let's kind of sit it out for a minute. And then a lot of times people think doctors really know everything and they trust their expertise, but sometimes it's good to have a second and third opinion.
Absolutely.
And then also read your medication list.
Very
so
helpful.
many medications counteract with other medications. Even a simple natural charcoal cleansing, people don't know not to take that after your medications, and then your medications don't work.
Exactly.
So those are kind of my little tips.
Thank you. That was so helpful.